our community, and that's where we are, so that we can educate our people, especially with this very unusual and unexpected circumstances. We all are going through really a lot, a pandemic affecting the entire world actually, and of course our cities, our state, and our country here. So we thought about that, how we can really contribute to the well-being of our community. I mean, many of us are at the forefronts in the hospitals, others are in the background working very hard to make sure that the operations are run smoothly. So we thank everyone for that. Now we had a big panel, almost 10 to 11 physicians. So we divided it and we realized that this is going to be an ongoing pandemic for a while, maybe weeks to months. Nobody knows exactly when we can expect that it will be over. Let's hope that it goes over soon and we all are healthy and safe and without any tragedy affecting anybody. So we divided the group in at least 6 speakers today, and 6 speakers we'll do next week, which will be March 27th, Friday, again at 7:30. We will start to hear from our mayor that how the city is coping, and then he will be complemented by our city manager, Mr. Edward Augustus, who has also joined us. They both will give us updates about how city is coping with this pandemic. Then we will have our expert physicians from infectious disease, from geriatrics, because that's the population most affected. And we will have our Imam also talk about that how, this has affected us as a community and how we had to close our center and go that, and how, spirituality can play a role in this entire scenario. So without wasting further time, I'm going to ask our mayor, Mr. Joseph Patey. Joe, you are going to just give us some perspective that how things are. So please proceed.
Thanks, Doc. And I appreciate you asking Ed and I to come on the phone today and do the video conference for your community and Worcester's community, really. And I can assure everyone that the city manager and his team, Dr. Hirsch, Dr. Maggie Castile, the public health department, our emergency response team, have been working really, I'll be honest, 24/7 for the last 2 weeks. To really plan for what we, like you were just saying, we don't know if it's coming this week, but they're expecting the height of this probably sometime first or second week of April to hit us. But we've been working hard to make sure we planned very hard to all the different issues over the last 2 weeks. And the city manager, to his credit, gets up probably at 4:35 every morning and probably on his way to bed by 11. But he's putting a lot of time into this, and I want to thank him in front of you so you understand all the time we put into this. It's all hands on deck. I'm just going to start, maybe give you some, and Ned can fill into, is just where we've been, and I'll just start with how we do the press conferences. And we're taking this very seriously. The community has come together. We have a lot of different groups out there. The city, the faith-based groups are working, the neighborhood groups are working to plan on volunteering, making sure that people are being taken care of, especially our most vulnerable, our elderly, all the residents, and we're working very hard to do that. I start every press conference with one thing, is that, practice good hygiene if people are listening. Make sure you wash your hands. Make sure you cough into your sleeve or sneeze into your sleeve. Make sure you keep a physical distance. Dr. Hirsch likes to say, don't say, use the word physical distance because you still want people to socialize on the phone or in other ways, maybe not in person. So I think that's important. Make sure you get your information from reliable sources. Don't listen to the gossip. We have worcesterma.gov, worcesterma.gov /coronavirus. If you want to get all the updated information, we put a lot of things on that site. We ask people to continue to take care of their neighbors, look after the elderly, call somebody who knows by themselves, make them feel welcome. And Ed will mention this, and I'll mention this. There's one thing that we put together. The city manager he worked hard with, created with the Community Foundation and the Alden Trust and United Way, and you've created a fund, a short-term and long-term fund to help people who are in need. That fund's up to $1.9 million now. So we'd ask you if you can publicize this fund. This is what's going to really keep us going, this money to take care of everyone in our community. You can go on the worcesterma.gov site, and if people want to donate to that, that's very important. But I'll go through some of the stuff here. So we've been telling people in the city of Worcester, as you know, all city-sponsored events have expected attendance of 25 or above have been canceled. As of March 12th, the senior center has been closed until further notice. You know, again, we do have the city website, COVID-19, get all the information you can get off it, www.worcesterma.gov, coronavirus. And we have a video library on this page, which with health tips and facts about the virus. That's done by Dr. Hirsch. And he's been doing a great job with the community here. We also have a hotline or information line for people who have been tested or waiting for their tested or have been tested positively. People can contact 508-799-1019. We have people 9 to 4. We have nurses on staff that can answer those questions that you may have. And if residents want to sign up, we've had a lot of people signing up for Alert Worcester that comes across your phone. So if people want to go on the website and sign up for Alert Worcester, that'd be wonderful. City playgrounds are closed. The parks aren't closed, but the city playgrounds. It's important you tell people listen, don't let your children on the playgrounds because as CDC came out, early this week, they think surface touching is one of the biggest spreaders of the virus. So we're trying to keep people off the playgrounds here in the city of Worcester. But the parks will remain open for public use. City manager and Dr. Hirsch and myself, we gave a daily briefing at the Emergency Operations Center by the airport at 5 p.m. every day. It's on Facebook if people want to listen to that, to know what's going on. Worcester Public Schools have been doing great. I know the schools are closed and they've had a mobile meals program for the kids. They started it yesterday. They gave out 600 meals yesterday. Today they gave out 2,000 meals. It's a packaged meal for breakfast and lunch, and they used the summer feeding program drop-off sites they used last summer. So the manager's been working hard, and Peter Dunn on the small business and making. That's going to be one of the biggest issues. Just got off a conference call with Ed Markey. They understand, the Senate, the Congress, that all these small businesses like at the heart of what really keeps the economy going. And Markey has been working hard to get this financial package through. They're focused on that. The manager, Peter Dunn, put this, call it the Small Business Resiliency Grant Program he put together. We announced that, I believe it was yesterday we announced that. Ed put $500,000 into that, for a $10,000 max per business grant. It's going to help like 50 businesses that were located in the city of Worcester who experienced a loss because loss of revenue of 50% or more due to COVID-19, and since March 10th, and we'll have less than $2 million in gross receipts. And that's going to be live on Monday, so if people want to go in, some of these small businesses, and apply, that application will be online. They're going to have, anybody needs some help speaking Spanish, we need some Albanian, will be on staff to assist people, any type of language barriers. And so Ed's hoping to put more money in the CDBG block grant. All the mayors are on today with their marketing. We've asked them for more money for that in the future. Some other things, as you know, we have emergency declaration in the city. The manager audited. One of the things that he did, as the council's request, was delay the plastic bag ban. I think Shrewsbury may have one too, but we delayed that until July 1st. July 1st. It was supposed to go into effect on April 1st. So we delayed that because they think these cloth bags people are using, the virus may stay on you a little bit longer and spread a little bit easier. So for the health of people of Worcester, we did that. And again, that fund, I have my notes again, the Worcester Together Fund, if people you can really put that out there on your websites and on your Facebook pages, because this is going to be very important for Worcester going forward, so we can fund our all the programs that we take care of people here in the city of Worcester. Ed's we're going to unemployment claims. Ed's working with the state. He's got a team of people who are helping doing applications, and people can find information on that as they go forward. regulate the Worcester Fire Department inspections of smoke detectors when people are selling their homes. Those continue as usual. I know people were worried early in the week on that. Stuff that Ed's employed is the Worcester Police Department cruisers are being thoroughly cleaned after every shift. So we do 3 shifts a day. So we continue to do that and still respond to all emergency calls. So people should know that. The Department of Public Works drop-off site is, in-service site is closed, but people can still call remotely or emailing at 508-929-1300. If they have any concerns, or dpw@worcesterma.gov. Some of the other things, our water drinking, and this is another question that came up. Our drinking water is safe here in the city of Worcester. People should know that, and your drinking water probably is too. Everybody's is, because they use the ozone and chlorine that really prevents the virus from surviving in the water. So people can use the tap water and feel completely safe. Green Hill Park Farm and old playgrounds, like I said earlier, are closed the first notice. Ed will probably go in. Ed worked very hard. It's been very stressful for the city, but to see me, I gotta give him more credit. I'm sorry if I'm gonna give him more credit, but he put a homeless program together. He can explain that. I put a lot of time and energy into this, and I'm pretty proud of what he did. Pretty much, I'll just turn it over to Ed, but this is important. I'm glad you're putting this out there. And we do have a conference call every day at 5 o'clock if people want to listen. We give an update on the number of cases in Worcester County who have the coronavirus. And, right now it's pretty low, but we expect that to increase as time goes on. And they can go through on that analysis. But if you want me to turn it over to Ed, if he wants to fill in that. And Ed's in between stops. He's taking the time out. He's in his car. So to do this for you guys. So thank you.
Thank you, Mayor Petty. That's wonderful. Really, that's a great effort, and we are eager to hear from Ed. Ed, Mr. Augustus is our city manager. Ed, are you able to hear us?
Yes.
Online, right? Wonderful.
Yep.
Please go ahead.
Thank you, and I just want to echo the mayor's appreciation for giving us this opportunity to further get the message out to all parts of our community and let folks know what we're doing and what we're hoping that all of our community is going to pitch in and do to help us together get through this global pandemic that we're all dealing with. We have, as of tonight, 7 confirmed positive cases in the city of Worcester. There are 20 cases in Worcester County. We know some of those 20 cases in Worcester County were folks who work in Worcester, but may live in one of the area towns. So the impact that our community is facing is more significant than just those 7 positive cases that I mentioned. We think that the people who are testing positive now were people who were infected 2 or 3 weeks ago, but because there's been such a delay nationally in terms of testing, and some of the test results it shrunk down now to 2-3 days, but it was taking 4 or 5 days to get the test results. So because of that lag time, we think that there's a significant number of additional cases in the community. And unfortunately, many of the folks remain asymptomatic. And so they are spreading it and have spread it unwittingly because they don't have symptoms. And we're expecting, as the mayor alluded to, probably by the 1st or 2nd week of April, as testing catches up, to see a very significant number of cases in Worcester and across Massachusetts and, of course, across the country. And so we are planning accordingly. We are planning for the worst case scenarios. More than 10 days ago, we opened our emergency communication center, which has allowed us to bring all of the various city departments that will have a role in responding to this. It's a fairly sophisticated operation that we built several years ago for any number of emergencies that the community might face, from weather emergencies to active shooters to terrorist attacks to pandemics. The good news is the city plans for all of those various scenarios. We drill on those plans so that all of the relevant city departments know what their role is in responding to that. And we put resources toward the technology, the redundancy of that technology, and the staffing. There are a number of folks whose job it is just to do emergency preparedness and planning, both in the public health department as well as the emergency management department. So I think that investment and that planning is paying off and giving us the ability to hopefully use these weeks and days to be prepared for when we do get the large number of cases. And what we're doing is what I think every city, state, and the country is trying to do, which is to make sure that when that wave hits, that our healthcare institutions have the ability to deal with the most severely impacted, the folks with the underlying conditions, the folks who are elderly, who are going to get more sick than the average person will, and that our healthcare system can meet their needs, and we don't get into a situation where we've seen in Italy, where they're having to make very draconian decisions about who gets access to limited healthcare resources. We don't want to be in that situation, and we're doing everything we can to prevent that. So a few things that we have done is trying to help our homeless population, many of whom do have those underlying conditions that make them even more vulnerable to this virus. So today we opened our first satellite shelter at North High School. Tomorrow we will open a second one at Technical High School. And then Monday or Tuesday, once we receive delivery of trailage shower units, we will open 2 additional ones at St. John's Church and Ascension Church in the Vernon Hill and Canal District neighborhoods of Worcester. And that'll allow us to have 4 shelters with 25 homeless people at each shelter. And then we will continue our regular shelter on 25 Queen Street with another 25 homeless folks there. That's going to allow us to keep them, more spread out than all in the one shelter location. Before folks are moved there, they're all being screened. So their temperatures are taken. We have doctors who are checking on them. And then ultimately, as we may have some cases, some individuals who are homeless be tested, we'll have quarantined locations for those who are awaiting test results. And then as some of the homeless population may become positive, we'll have another segregated area. We're looking at one of our college campuses and their dorms to use for those types of facilities. We've also been in close contact with St. Vincent and UMass, again, looking at some of our college dorm space to create overflow for the hospitals. There's some concern that the long-term care facilities, nursing homes that we saw in Seattle can be very, vulnerable populations. That if somebody gets the virus, goes to the hospital, no longer needs to be hospitalized, but some of these facilities would be concerned about taking them back. We want to have, for lack of a better term, a respite type location where they can go, get the proper care, but not hopefully jeopardize other frail elders in these facilities, and looking at creating locations where they can go and be cared for. So the colleges are working with us to create some of those locations, and we're hoping to have those up by the end of next week. So again, we won't flood or overflow our hospital beds. The hospitals obviously have taken many measures to prepare themselves, canceling elective procedures, repositioning floors and locations within the hospital to be able to accept as many patients as they may need to. So aggressive testing has begun. We do have some testing at the CVS in Shrewsbury that is particularly focused on our first responders. And starting tomorrow, we will be sending our Worcester police and firefighters there to be tested in an effort to, again, make sure that we're ahead of this. If we have some positive cases, we can take those first responders out of circulation and be able to make sure that we can meet the public safety needs of our community. That was one of the primary reasons the governor activated the National Guard, because as these first responders get tested, and if we have some that are taken out of commission, the National Guard can back up communities where necessary to do police and fire functions. We, as the mayor said, every single day for a week now, we've been doing 4 o'clock conference calls with all the elected officials in the community, and then a 5 o'clock briefing that we do with the media. And we do that primarily to make sure that the community is aware of what's going on. We think being transparent to share whatever the latest developments are is an important way to, fill the information vacuum that can sometimes be created in situations like this with accurate information that is based on science, based on medical advice, and reassure the community that there's a lot of people who are working very hard to keep them healthy and safe, and that we're following all the best medical advice to deal with this. And I think it's been well received and hopefully reassuring, because sometimes social media outlets and other sources can be sources of false information or confusion or fear. And we want to try to fill the community with accurate information that, is sometimes disconcerting, but it's fact-based, and it's not something that is, just a rumor that's going around. The governor, of course, closed bars and restaurants. Restaurants can stay open only for takeout and delivery. And we are very aggressive in following up with our restaurants and bars in the city to make sure there's compliance. And we are very prepared to take away any establishment's license if they violate that. That's a matter of public health for the folks who would go in there, and for the first responders who would have to go in and break that up. So far, 99% of the businesses have been very cooperative and compliant, and we are going to continue to be working with them to make sure that we have that compliance. Those are the big pieces. I'm happy to answer questions or hear from folks, the mayor and I. Again, I just urge people to just tune in to those 5 o'clock briefings. We're going to do them 7 days a week. They're available live on a lot of the media outlets as well as the city's website. Stay informed. We'll every day tell you about the new cases and any new developments or actions. One last thing before we open it up. I know there are a lot of rumors about whether there's going to be a shelter-in-place order or quarantine. Some states have taken those actions. The only ones other than the federal government who can do that are the governor or in the city of Worcester, the city manager. And as of right now, we have no intention of doing a shelter-in-place or quarantine at this moment. There may be a time down the road that we get there. We're not there right now. And I know the governor in his press conference said that he's not there right now. So there are a lot of rumors going around that there's going to be a shelter in place. There isn't any time in the immediate future. We will keep the community informed if that changes at some future time.
Thank you very much, Mr. August. As our city manager, he was briefing us about our situation in the city. Now, Mayor and our city manager, our plan was to have a few other presentations. So there are our esteemed physicians from infectious disease and the geriatrician and our Imam. They each will have 5 minutes to talk. If it's okay with you guys to hold off the questions for you both for 20 minutes, or if you have to rush some other meeting, then I can put the questions now. So whatever you advise, I don't want to impose any limits on your time.
Nope. We can wait.
Can you try to give us the questions now? Because we, I know Ed's in between stops and, okay.
Okay, all right, that's fine. So our physicians, so we will hold off our presentations for maybe next few minutes till we address these questions. So a couple of questions you already answered. Ed was right on it, and Mayor, you also mentioned about that, but somebody posed a question that what are they, how to apply for these grants?
Well,
Yeah,
for the, go ahead, Ed. Go ahead, Ed.
I'm sorry, for the small business programs, you just go on the city's website, worcesterma.gov, and the grant applications are there. And all of the information that the mayor and I referenced about various programs or information about what's closed and guidelines, that's the location. And as new information becomes available, that will always be the central spot for applications or information.
And that grant application will be available on Monday.
On Monday. Okay, great. Now, Mayor and City Manager, we are an integral part of the Worcester community. The Muslim community wants to play an active role. We have at Worcester Islamic Center our young youth who actually came up with a plan that how they can help the elderly to go and get them the pharmacy prescriptions or any groceries or any help along that line. So we want to be part of that, and we want to encourage our youth to really get involved in whatever they can do and contribute. But please tell us from your side that how can Muslim community play an active role and help our community members in Worcester?
Yeah, we're trying to match people in the volunteers, and I know we have a number of volunteers for the faith-based community. I talked to the city manager today, and they're going to try to come up with a program, try to figure out how we can get these volunteers when needed, try to almost create like a task force where we have urgency here. But we do have like people who want, if you elderly do need help, they can plug into the senior center and try sign up there. Like we had 600 calls. We make a day, making sure everybody was all right, asking them if they're all right and what do they need. So so if the elderly do need that, I can send that message too. Ed, do you have anything else on the volunteers? Or?
Yeah, I think just, you know, because the city is got a limited number of resources, to the extent that the faith-based communities can kind of take care of their, you know, congregations or their own folks, you know who the elderly, who the folks who may be disabled within your community are. If you could create a system that reaches out to them and kind of pairs them up with someone else from the mosque who checks in on them periodically, as you mentioned, Doctor, if they need additional groceries or they need a prescription refill or something of that nature, there's somebody from the mosque who kind of works with them to kind of keep their eye on them and take care of their needs if they have, they're frail or they have an underlying health condition, somebody who's going through chemotherapy or something of that nature, and their immune system is compromised. Those are exactly the folks who should not be out and about. And if we can kind of help them stay isolated from other folks, that's one way that we're going to help keep them healthy and hopefully not coming into contact with the virus.
Thank you. I think many of the people here have commented, and thank you for a great meal program for the kids. I think that's a great initiative, especially when the kids, they are from the underserved areas or economically from a poor background, especially they are being out from the school lunch program. So that's a great effort. People want to compliment you on that. And then somebody had asked a question that what are the current sites for testing in the city of Worcester?
The sites are St. Vincent Hospital, UMass, both have drive-up sites, and then there are a number of private clinics. Now, as far as testing goes, at this point, testing can only be ordered by your doctor. There's a set of questions that, you know, if you feel like you've been exposed or you have some of the symptoms, a dry cough, chest tightness, you should call your primary care physician, and they will ask you a series of questions. And if they think that you know, have been exposed or you have the right set of symptoms, they will recommend you for a test. Right now, we don't have, because of the federal shortage of tests, we don't have just anybody can go up at this stage and just ask for a test. You have to meet certain basic criteria before you could be recommended by your doctor to get a test. If you do meet that criteria, St. Vincent or UMass have drive-up locations, and then there are several other labs that are doing tests as well. We're hoping somewhere in the near future we're going to have the ability to have generally available tests that anybody can take, but we're not there at this point.
Excellent. Excellent. Thank you very much. I think you clarified the shelter-in-place order also, so that's great. We already posted a site that how people can go and look for these resources on worcesterma.gov and /coronavirus. If you want to get the information on that or the grants, then just go www.worcesterma.gov. That will be a good resource for your information also. So again, there are many community members on the chat. They are thanking you, Mayor, yourself, and our city manager for really sparing your time coming and joining us. I'm sure there will be others who may pose the questions, but if there are any specific questions, we'll obviously be in touch with you. You are welcome to stay online with us. We are going to continue with our physicians now, if that's okay.
Sure. Thank you.
Thank you very much. Thanks for your time. Great. So for the next part of the program, which will be our medical related, we have, as I said, our physicians who are ready to give you first-hand information. I will start with our two infectious disease specialists. First will be Dr. Fozia Kamar. She will give you some update about the COVID virus. Go ahead, Dr. Kamar.
Assalamu alaikum, everyone. Hello. So first of all, thank you so much, Dr. Ramzan, for inviting me for this talk. I know most of you are pretty much up to date with what is going on and what is, there's so much information on the media nowadays that I don't want to just repeat everything. So I'm going to talk about a few things which I think are important for you to know. If I can go to the next slide. So just to talk about historical perspective of this virus, the coronavirus, a lot of people think that it's some kind of a very new virus. Yes, it is new in its own way. However, we know the coronaviruses have been out there for a while. They were first reported in Asia. So there are many different, types of coronaviruses, but some of them have caused some very serious illnesses, such as SARS and MERS. First reported in Asia in 2003, this illness spread to at least 26 countries and around 8,000 people were affected from it, including US. And the case fatality rate of this disease was 9.6%. Total deaths were 774. If we go to the next slide, we'll talk about MERS, which is Middle East Respiratory Syndrome. This is also a coronavirus. It caused almost the same kind of an illness, and it was first reported in Saudi Arabia in 2012. Since then, after that, it spread to 27 other countries, including US. The total cases were around 2,400, and their case fatality rate was very high for coronavirus, around 34%. So total deaths were 858. Next slide, please. So now here we are with this new novel coronavirus, which started in early December. Several hospitals in China noted an increased number of patients with one particular type of pneumonia, like picture or repeated on a chest X-ray or CT scan, and patients presenting with almost the same kind of an illness. Finally, they were able to make the link to a Wuhan seafood market. Can we go to the next slide? And after that, you pretty much know what happened. Basically, from China, it has now, as of yesterday, spread to this whole big map of this world. So let's talk about a few things regarding coronaviruses. I want to talk about myths versus reality. Bats, medications, what's out there. So if I can go to the next slide. So there have been many questions. Who ate the bat? Why did it really start? So let me explain to you what exactly happened. on my next slide, you're going to see. So see, the coronaviruses, as I said, mentioned before, that they're a large family of viruses that are common in people as well as in many different types of animals like camels, cattle, cats, bats, etc. Bats are the main reservoir for the virus, right? So the virus just lives in the bats. It has been sitting there for years. At some point, what had happened is that the virus jumped from the bat to another kind of an animal. And from there, it speciated into something slightly different. And then humans got infected. What had happened is, if you go to the next slide, I'll show you, this is the wet market in Wuhan. What happens over there is a combination of dead and live animals, right? So if you see, there are live turtles down below, there are live frogs there in the picture above, then there is a person chopping up the frogs, and such unhygienic conditions. I think he's not wearing gloves, or maybe he's wearing a nylon glove in one hand. There are dead animals, then there are live animals, so there's a combination. So when that happens, whatever the diseases are, they can aerosolize. What that means is it can come in the air and anybody can inhale it, and that person can now get that virus. And that's how it basically started. So if I can go to the next slide. So a lot of people think, what's the big deal? It's like flu. As we get flu every year, so we can get coronavirus also. So if I can go to the next slide, I'll show you why it's a big deal. It's a big deal because it's more deadlier than the flu. If you see seasonal flu on your left on this graph, it's below the new coronavirus. It's way more contagious. It is less contagious than MERS or SARS or measles. However, it's more, it can make people more sicker, and it is way more contagious than the seasonal flu. If I can go to the next slide. So I do want to talk about a few things here regarding what's out there in the social media, what are people talking about is, and I have faced like so many questions about different things, and I really want to touch on that. First question, which is frequently coming up, is should I stop my blood pressure medicine because we got this WhatsApp message that lisinopril is just gonna worsen if I get coronavirus. So all the societies of hypertension, nephrology, they have come up with a consensus. NHS, which is the British Society, the American College of Physicians, which is American here, they all have come to the consensus that people should not be stopping their blood pressure medications because we really don't know at this point. This was a hypothesis, this was something. It is possible that these medications might be actually helping with coronavirus clearance from the body, or it might be worsening, we don't know. What may happen is if you stop your blood pressure medication, your blood pressure is just going to become out of roof. You can, if it is being prescribed for congestive heart failure, people may go into heart failure. So we definitely don't want you to stop your blood pressure medications. Then for last 24 hours, I have received several calls regarding prescription for chloroquine because they've heard on television that chloroquine is a great medication, and if it's prescribed, it's just going to cure their virus. Once again, let me tell you, FDA has approved it for its use as a compassionate medication. What that means is when we don't know anything, when we're like, we don't know what to do, and there is a hypothesis that it's possible that this medication may help, then okay, go ahead, you can use it, but at the same time, start doing some research on it. There are many questions regarding chloroquine, hydroxychloroquine, which is commonly called as Plaquenil, which may be prescribed to people for arthritis or lupus. And if you stop taking your medication, or so basically, if people start taking it and stockpiling that medication, those people who actually need that medication, like the lupus patients, they are not going to get their medication. So we don't want to do that, certainly. Hospitals don't have a lot of stock also, but if needed, if proven, then it will be prescribed, of course. At this point, again, we don't really know if it is the right medication or not. There is some data, but that data is not very, as I said yesterday, I've seen that data. It's a French study, it's a very small study, and it's not very effective, we don't think yet. We know that hydroxychloroquine, chloroquine may have some effects on the virus, but that is what has been seen in the lab. It is not proven in a human body. So those are two different things. It may actually cause some side effects, such as on the heart rhythm, which is called QT prolongation. Some problems in the heart can appear. So there are side effects. It's not free of side effects. So I would appreciate if nobody asks their doctors to prescribe that. And then there have been questions about ibuprofen, Advil, Aleve, if they are causing any issues. Then again, unfortunately, we don't know much about it. At this time, I think I am going to ask my patients to avoid ibuprofen or Advil if they do get coronavirus. If they are taking it for other reasons, keep taking it. It's not like you will get coronavirus if you take ibuprofen. However, if somebody gets it, I would suggest, that's my personal opinion again, it's just based upon prior data which we have seen on viruses. It's not based upon just coronavirus. It was based upon what we learned a little bit from SARS. So that's where we are. So I believe that is it.
Thank you very much, Dr. Qamar. That was great. I think we are going to shift gears and go to the next, our infectious disease expert, Dr. Qayyum. And we will hold off the questions for our experts once these 4 presentations are done. So Dr. Qayyum, please proceed with your presentation. Thank you, Dr. Qamar.
Assalamu alaikum. I'm Dr. Asma Qayyum. I practice internal medicine and infectious disease. And thank you, Dr. Ramzan, for inviting me over, and also Dr. Qamar for such a great presentation. You've touched on a number of things that have raised the curiosity and as well as the fear factor in the community, and hopefully a lot of what you said will help to quell that. I'm going to approach this topic from the point of view of an internist in the public setting. So there are many things that will overlap, and we need to be able to tease out whether is it flu, is it allergy, or is it COVID-19. The good thing is that we do know that we have vaccination for influenza, so those people who have taken it may not be worried as much about that. Allergy symptoms, as are listed right here, you can see there's an overlap with the flu, but most distinctly the COVID-19. If you were to call your doctor's office, which you should if you're not feeling well, especially in these days, they will do a triage, which will whether you have a dry cough, and if you have a fever, and if you're having difficulty breathing, and lastly, if you have traveled to one of the places which is now endemic for this particular virus. The fever, you can define fever as a temperature of 104 and above. Nothing below that. A low-grade temperature could be for many other reasons. However, in the influenza, you'll have a sudden spike and with body aches and myalgia. So in that ways, you can somewhat be not as scared that you may be carrying or harboring the virus. Having said that, I'm a big proponent of the influenza vaccine. If you've taken that, because as Dr. Qamar just mentioned, there are more fatalities from influenza every year. And if we are protected against it, chances are that we have some kind of immunity. That brings me to why COVID is such a big deal than the flu is. It's simply because the coronavirus is really a virus, an RNA virus, which has jumped from animals to humans in that particular market that Dr. Qamar was mentioning. The other thing that it did within 2 weeks was it jumped from humans to humans. So that is the big deal with this. The problem with that is that because the humans have not seen that kind of viral, the RNA sequencing, our bodies are unable to react and protect us. So basically, we are bare as far as this virus is concerned. It takes a while for the immunity to develop, but we don't know how long. We do know, however, a few things about it in terms of rates of transmission. There's something called the R0 rule, which basically says that physical contact may not be necessary, especially in this particular virus. It is the contagion which matters. And basically, we do know that I think there is 2.5 to 3 persons at one time can be infected, and they're then capable of infecting up to sequentially 1, 3, 9, 27, and so forth. So that is one thing to remember. The other thing is, people will ask you that why isn't there a vaccine? Well, a vaccine takes a while to develop, and that we also know that this particular virus has 2 serovars. One is the L, which is the severe, and it spreads quickly. And then there's the mild form, which is not as aggressive as the other one is. So the L form, typically from what has been gleaned from the data from China, is that that will set you off into an ICU kind of a situation. So a lot of people can be, as you can tell, be exposed, but they may not necessarily be infected, which kind of sounds counterintuitive, but that's where staying home and social distancing is going to help, simply because we want to flatten the curve. If we could go to the next slide, please. The social distancing part is right here. We know you're going to avoid gatherings. You're going to use caution in certain gatherings. And some things are safe to do, which is really connecting back to your family. You don't have to go out in large groups. You can take a walk, go for a hike, do yard work. But in terms of group gatherings and going for elective surgeries, etc., you should really be avoiding a lot of those things. In this day and age, we do have pharmacies who are also delivering medications at home, so certainly you could make use of that. So social distancing, as you can see, that one person can make a huge difference. You step back, you stay home, and you slow the spread. That's where it says. The other thing is, probably for the first time in the history of mankind, we're saying divided we stand, united we fall. Basically, if you're going to be congregating with people, that's what's going to happen. So we want you to stay at home, stay away from people who are vulnerable, away from grandparents, try not to visit them in this time. Staying home will do one thing. It will flatten the curve. You may have heard about that. Flattening the curve means, especially if you look at this, you have cases and then you have people who will at one point suddenly have the infection. We don't want that to happen. So the social distancing will kind of blunt that curve, and that ways we will not all be getting sick at the same time. Chances are we will. Most of us will recover, and most of us will not need the ICU. But if we do, then it will be spread over a greater period of time, and then the healthcare, the ability of the healthcare to kick in and look after you will be greater, as opposed to all of us getting sick at the same time, which is going to put us all at a disadvantage. So the social distancing is very, very important. And just for reference, you probably also know by now, you need to stay away from each other for a distance of 6 feet. If you're going to the grocery store, if you can manage that, that would be great. As far as contagion is concerned, the measles vaccine, if somebody has measles in an uninfected population, you are capable of infecting 18 people. And in terms of when you are infected with coronavirus, it's a little different, as we mentioned, but it will be more severe. So that's one thing to remember. Others that are, by contrast, are transmitted by body fluids like Ebola and HIV are less easy to catch, but can be aggressive, but then we know the mode of transmission. So essentially, practicing hand hygiene is important. You want to make sure you're getting in an elevator, you use your knuckle. If you can push open a door, you should be doing that. You should be washing your, whatever, your hands, and also, after flushing, you need to make sure everything is clean. I think I have taken up a lot of time, but if you look at this again, education is key. As long as we can teach each other hand hygiene, don't touch your face, don't touch anything, don't eat anything without washing your hands. And then again, I stay away from. When you do that, you kind of help to blunt that curve. And there's one last slide where I think for the first time in history, we can save the human race by laying in front of the television. There's nothing, let's not screw this up. Stay home. enjoy your family, do all the hobbies that you ever wanted to pursue, and look after yourself. This is quite beatable if we just get engaged in it. Thank you so much for your attention.
Thank you very much, Dr. Qayyum. The slide said that women working, I think it's time to men to be working at home when they are not doing anything else. So rather get them to work. We have questions lined up, which we'll be talking, but we'll proceed with our next presenter, Dr. Sheikh. Dr. Sheikh is a geriatrician at UMass Medical Center. So Dr. Sheikh, please give us a perspective about the elderly population, which is your specialty, especially that there's so much talk about this population being so vulnerable. So thank you.
Assalamu alaikum and hello, I'm Zahra Sheikh. Like Ramzan Bhai said, I am a geriatric doctor, and thank you very much for giving me the opportunity to be able to talk here. And Dr. Qamar and Dr. Qayyum, thank you very much for your talks. I think you gave a very good perspective on how the disease came about and what we can do to spread. I wanted to specially talk about our elderly population because they are the vulnerable ones. They are the people who are the most affected from this disease. My talk is going to focus on why COVID-19 is so dangerous for older adults, and then how can we protect our older adults. My kids this afternoon at dinner, they were talking about a few generations down, and they'll be like, maybe people won't have any more grandparents. You know, and that really gave me a shiver down my spine, that if a couple generations down, what are these kids going to do without grandparents? So we really need to protect our older people so they can have these memories. They can have these special people in their lives. So if we can go to the next slide. We know from experience, we know from what happened in China that the older people are so vulnerable. If you want to look at this graph closely, it shows it so clearly that the percentage of case mortality rate, the mortality or the number of people who passed away because of corona between the age of 10 and 19 years, it was less than 1%, just 0.2%. 20 to 29, still 0.2%. And then it goes up after the age of 150 to 59, it's 1.3%, 60 to 69, 3.6, and 70 to 79, 8%, and above 80, it jumps up to 14.8, almost 15%, which means out of 100 people who get coronavirus who are above the age of 80, almost 15 will pass away. They won't be able to sustain it. So it's more dangerous for people who have not even chronologically that old, but who also have a lot of comorbid conditions. And I'll talk about it in the next slide, if you can change over, please. So in the United States, so far we have had it for a few weeks, and we have already come up with some statistics. Here also, it's somewhat similar, but so the blue, this one is called a bar graph. So the blue bars are showing us the number of people who are hospitalized with coronavirus. The orange ones are people who are in the ICU, and the gray ones are those who died. So in the 20 to 44-year-old, a lot of them were hospitalized. Some of them were in the ICU, but very few died. They made it. But then let's jump a few decades over to 65 to 74-year-old. A lot more were hospitalized, a lot more were in the ICU, and a lot more passed away. Jumping over to the 85-year-old, again, the number of people who were hospitalized goes down, but the number of people who died actually goes up, because many of them may die very suddenly. So the cause of death could be a cardiac arrest, could be a heart attack, and you may never know, but corona might have been there. So if we can go to the next slide. So in the United States, so far we know that 8 out of 10 deaths that have been reported, they have been in adults 65 years or older, and they're ranging from 10 to 27% in more than 85-year-old. It's followed by 3 to 11% among people aged 65 to 84-year-old. So epidemiologists are predicting that once the dust settles down, the overall mortality will be 1%. But at this time, because testing is not available to everyone, and because we are focusing on older people, it's a startlingly high number, 3 to 11%, 10 to 27%. And if we can go to the next slide. So the reason older people are more vulnerable, because chronological age alone doesn't determine who is at risk. It's the number and severity of underlying conditions which determines. 60% of Americans have at least one comorbid condition. It could be diabetes, it could be heart disease, it could be kidney disease, and all of these diseases and the age, they all decrease our immune function, and which doesn't give us the power to fight infections like Dr. Qayyum had mentioned earlier. And the number of white cells also decrease as we age. And 2/3 of people who have died so far in Italy, they had 3 or more coexisting conditions. So we know that it's going to affect those people with chronologically advanced age or with comorbid conditions. Going to the next slide. How do we protect our elderly from COVID? The main thing I wanted to focus at, protect yourself. So if you protect yourself, you're not going to be vectors to bring that disease to your elderly. So how do you protect yourself? Over to the next slide. Essentially take care of yourself as a caregiver for the elders. Take breaks from watching. So emotional health and physical health, those are the 2 things I wanted to talk about. So this is a very stressful time for all of us. We at work are stressed out, our kids are stressed out at home, we are watching news all the time, and I really need to advise you to take breaks from watching news, reading or listening to stories, or being on social media all the time about this pandemic. Take care of your body, take deep breaths, stretch, meditate. Being spiritual, having faith in Allah is very helpful. We should all try to eat healthy, well-balanced meal, exercise regularly. Weather has been on our side, so go out for walk regularly in the air, fresh air, get plenty of sleep, and you can consider utilizing some natural antioxidants. Evidence is anecdotal, but we know that vitamin C containing foods like lemon, antioxidants like ginger, garlic, turmeric, they may help improve your immune response. So offer them to your elderly, or take them yourself, and then make time to unwind, to try to do some other activities that you enjoy, and stay connected with others. Talk to people that you trust about how you're feeling. And it can happen to anyone. It happens to me as a healthcare provider, and I confess, sometimes at work I'm like, I wish the ground would open and I would sink inside. And I want you to know that it is natural to feel that way in these circumstances, but then try to do all these activities to relax and to have faith and try to do your best. So going on to the next slide, try to prevent disease to your elders. So how can you prevent disease? So minimize physical contact as much as possible with those who are vulnerable. Keep other modes of communication active, so you're available for them in case they need help. In this age of technology, we have telephone, FaceTime, Skyping, and all that, social media. So keep in touch. Reach out to your elder neighbors. If they need any grocery shopping, you can pick it up for them. Do some errands or chores. If your elder ones resides at nursing facilities or assisted living facilities, as you know by now, they don't want any visitors, but all these facilities are allowing visitors through FaceTime or Skype regularly. Try to cleanse yourself with clothing change. And then last slide, older people, what they can do for themselves is going out altogether. May take outdoor walks. Stay hydrated as long as you're not in fluid restriction. And then comply with all your medications for chronic conditions like blood pressure medications, diabetes, or other medications. If you haven't gotten a flu shot, please get a flu shot now. At least you'll develop some immunity. And then frequently hand wash, clean surfaces with wipes. And then last slide over. If you have difficulty breathing or shortness of breath, fever and dry cough and stuffy nose, persistent pain or pressure in the chest, or new confusion or inability to arise, or bluish lips or face, please seek medical help urgently. And one last message I want to give you all in my next slide. So in this COVID-19 era, should you go out if you're young? No, if you're not young, you should stay at home. If you are young, you have a good immune system. If you don't have a good immune system, stay at home. Even if it is good, still stay at home. You can be vectors. You can transmit the disease. So the message is stay at home and stay healthy and clean. Thank you very much.
Thank you, Dr. Sheikh. That was wonderful. I think our last speaker for the day, we will go with Dr. Asif Irani. He is our Imam and resident scholar. He will say a few words about the spirituality and how that can play a role here, especially when you are so isolated at home.
Assalamu alaikum wa rahmatullah. So first of all, it's great to see the community coming up together, gelling up together, community officials, mayor, city manager, relevant physicians coming together in such a difficult time. This shows the bond of brotherhood and sisterhood which we have in this community, because in the difficult time to come up and to gel together tells us that we are a great community, and may God Almighty protect all of us. Ameen Ya Rab. Just two things briefly so that we can make this interactive and we can take your questions. I'm not a medical doctor, so from the medical perspective, I'm glad that we had great presentation so far. Just from the spiritual side, two brief reminders. One is we need to have this preventive measures. This is part of religion also. Prophet Muhammad, peace be upon him, told us that you have to abide by these medical advices. There is a fine line between extreme carelessness and extreme panic. And that's what actually we need to focus on, because panic can actually destroy you and destroy the community. Like people are buying and they are hoarding on the things which they're not supposed to buy. And there is a shortage of food in some of the grocery stores and in market. This is the result of panic. You have to take preventive measures. You have to abide by these guidelines, but make sure there is no hoarding. There is no extreme panic, because that can also destroy the community. And obviously we have to put our trust in God Almighty after taking preventive measures. In the same line, we don't have to become careless, because this is the other extreme. We don't have to swing like pendulum. We have to stay at a moderate path. Like we have to abide by state and city guidelines, CDC guidelines, and we have to take this as a religious approach, that my religion asks me to actually follow these medical guidelines and these state guidelines. This is one reminder. Second, and actually this is the last thing, that we have to just make sure that apart from all these medical advices, take this opportunity, being an optimistic person, that finding an opportunity even at the difficult times, take this as an opportunity to come close to God. That you have actually confined to your home, so you all have been social isolation nowadays. So try to come close to God. And in Islam, God doesn't criticize this if you, at the time of difficulty, at the time of adversity, at the time of hardship, will come close to God. Logically, you might think it's a selfish attitude. When you don't need God, when there's everything fine, you won't come close to God. When you need God, you will come close to Him. Logically speaking, when we deal with human beings, we might think actually it's a selfish attitude. But God Almighty, in multiple places in the Quran, instead of criticizing, He's complimenting. If you are struggling with something, come and ask me. So that's what we need to do. And the only thing which He criticizes is that once you come close to me and I have removed your hardship, I have removed your adversity, then don't go away. That's one thing which we have to be consistent in that. And may God Almighty protect all of us and our communities and our loved ones. Ameen Ya Rab. Thanks, Dr. Ramadan.
Thank you very much, Dr. Irani, and thank you, Dr. Sheikh, for a great presentation, especially for our vulnerable elderly population, and especially that you are so dedicated serving that part of the community, whether it is in the hospital setting, clinical setting, or even visiting the nursing home. That's a very difficult job, especially that you have to take care of your family and be with them with a lot of anxiety and all that. So hopefully, next time we will have two psychiatrists in our panel also, which will address the issue of anxiety and the problems with self-isolation or being at home and not doing much. But we are going to take a few questions here. I will start with one question which is not from our panelists here. Dr. Alom is there and we can unmute. And while Brother Nabil is doing that, I will just ask, I think we talked about ibuprofen and somebody asked the question that if ibuprofen is a problem, can they safely take Tylenol? So one of the panelists can go ahead. Dr. Kamar, you want to address that because you had talked about ibuprofen, but you want to tell them that it's okay to take Tylenol.
Sure, absolutely. Yes, I think it is absolutely okay to take Tylenol as long as you have not been told by your doctor that you cannot take for some specific reason like a liver disease, but it should be okay.
And the next question I will pose to Dr. Qayyum, that somebody asked if there is different rate of recovery. What is the reason that some people recover so clearly and very easy with minor symptoms and others get vulnerable and go to the ICU? Any input along that line?
Yes, certainly. Absolutely. There are people who have underlying conditions and they're immunocompromised to begin with. And that does include, age is a factor. Number one. Number two, if they have diabetes. Number three, if they are undergoing chemotherapy for any other reason, they're already vulnerable. So that also pushes them into that age group where you will be more, liable to. And then your recovery time depends upon how well you're able to bounce back, depending upon what you went in with. What was your baseline health at that time? And that will help determine how well you'll recover. Especially people with chronic bronchitis and smokers. I think the people with lung diseases will take a little longer, but this is what makes sense to me right now. They're not necessarily anecdotal, but we don't have long-term data either. But this is what makes sense after hearing all these conversations that we've had tonight.
Great. Thank you, Dr. Karim. And my next question is for Dr. Sheikh. Dr. Sheikh, the question is that you suggested to go for flu vaccination. So when will be the season for flu ending, when people can say this is not the time to go for flu, and especially that there will be overlap of symptoms? And should they still go ahead with the flu vaccination? What's your advice in that regard?
So I know that last year, over the past years, we haven't really seen a flu season. Flu has been all around thing now. So anybody who has not had a flu shot any time of the year, they really need to go and get it. So it's no longer a seasonal disease.
Okay. The symptoms can overlap, but then obviously...
Definitely. Yeah. So I actually diagnosed one of my patients, a nursing home resident who had symptoms on Tuesday, and I sent in her swabs for both flu and COVID. And at this time, thankfully, she was positive for flu, which is a blessing as compared to COVID. So yes, flu is very rampant right now, not only in older people, but in younger generation too. I've heard of a lot of college kids who came back from dorms and they have positive influenza. So we must and these are people who have had flu shots too. So as you know, flu shot is effective only in 50% of the people, but yet in 50% it's effective. So please go for it. And like Dr. Kayyum said, there is a cross immunity. Is that I think she referred to? So it might help in that way. I'll let you elaborate on that.
Can I please make a comment on what you've just said? I'm a proponent for the flu vaccine, and people will say that it didn't work last year, but by all means, you do get some amount of immunity. You don't get as sick as you would have had you not taken the flu vaccine. That's number one. And number two, people will forget by the time October rolls around, they're going to say, well, I took my flu vaccine in May. Well, guess what? That was the 2019-2020 vaccine. And this year's vaccine will be 2020-2021. So you will need another one in October. So don't do yourself a disservice and say, I've already had it. So if you're one of those who takes the flu vaccines, that's how you need to follow the pattern.
Excellent, excellent. Dr. Sheikh, another question along that line, that there are people who are active at the forefront, like physicians who are working in the hospitals, there are firefighters, there are our police cops, and there are many nurses and all the health officials, people who are opening the grocery stores for us, the pharmacies for us. And if they have elderly at home, what precautions they should take, how much they should be worried that they may cause problem for the elderly at home, which at present may be asymptomatic, but they may expose them.
So we discussed it as a group with my group of geriatric doctors, and we all decided when we come back home, we are going to leave our bags and our stethoscopes and our white coats in the car, and I come straight to my bathroom, I take off my hospital clothes, I put them in the laundry, and I do a complete wudu or shower. So really you should not be touching anything in the house when you come back from groceries or be it work, anywhere. So because as someone mentioned, it stays on surfaces for hours. It even stays on soft cloth for at least 2 hours or so, even though the viability decreases, like how strong it can cause disease decreases over hours. But we need to be very careful when we come from outside. So today, I think we had a case in Shrewsbury, which was diagnosed also. So it's around. We just have not been tested for it.
Excellent. There's a question for our mayor. Somebody asked that the cases which we have in Worcester, were we able to track that these people had the cases right here, or it was a traveler, or how do we know something more about these cases, which so far are confirmed 7 cases?
Well, a lot of it's confidential on the cases, but I know there was one that was associated with Biogen in the city, and there was no. If you're asking if there's a connection between the 5 cases, as far as I know, no. But I think next time we do this, maybe we'll have Dr. Hirsch on. He could probably give you some more connections on that. I know that some of the county cases are associated by working in Worcester, so there's a connection there. But there's no connection to the dot between all the patients, like knowing one another or coming in contact with, as far as I know. That's in the information they gave me.
So I know that here at UMass, we had a meeting on Wednesday, and they told us the 6 positives that we had in the community are in our outpatient practice. 3 of them were related with Biogen, and the other 3 were school teachers who had been exposed to students who had traveled from outside. By today, the number of outpatients for UMass has increased to 10 positive as outpatient. I don't know the statistics of other 3.
Yeah,
we have 1 inpatient right now.
Yeah,
we have one inpatient too, yes.
Yeah, we have like 7 in Worcester as of 5 o'clock this afternoon, and I think 19 to 20 in the county altogether.
20 in the county, yes.
Yeah.
Okay, thank you. As our mayor said that, just to remind you again that we will have part 2 of this program, again, same time next Friday at 7:30. So please stay tuned. Some of you may have questions which were not answered today, and some may have other questions which will be more specialist, joining us. So be prepared for that. We will have, as Mayor said, Mike Hush, who's our DPH physician over there and leads the effort from the DPH side. So he will be giving us the first-hand information also. Couple of things which the questions are coming in. People are worried that even though when you go out for a grocery or pick up something or somebody is delivering food for you, and you don't know that whether that person has been exposed or sick or not, because they may deliver pizza for your kids. They may deliver some, takeouts. You go there, people touch the food. How long the virus stays on these surfaces and how much you should be worried about? One of our infectious disease physicians can tackle that.
Yeah. So what we know from a recent study on the surfaces is that it can stay on surfaces for long periods of time. So we know from a recent study that it can stay on stainless steel and plastic for the longest time, which is 72 hours, so this was the minimum of 72 hours. Cardboard, around 4 hours. Clothings, we have no data on that yet, but it's anticipated 2 to 4 hours, but we don't know for sure. But there was this study which actually looked into these 3-4 surfaces and have come up with these hours.
Actually, if I could make a comment, it remains airborne for up to, in particular in droplet form, for about 3 hours also. So, which is important because again, if we are coughing in our elbow, it's a good thing. You can go home, remove your clothes, as was mentioned by one of the panelists. But if you leave it to float around, again, it's a disservice, but we don't realize at that time. And we can sneeze whenever, for a number of reasons. So it does remain suspended. So that's how long it will survive.
Excellent, right. Because some people say, on cardboard surfaces or things like that, they may even go up to 20 or 48 to 72 hours. And that creates a lot of anxiety in public that, where is that line which they can draw?
They were mentioning something about, again, toilet rolls coming from China, and they said do not use them because the cardboard inside, which will be harboring it, if people have packed it, that might be one way of fomite that would so all of that may be hearsay or perhaps not, but this is, the internet, so you never know which information to believe, but some are believable, as we were just talking.
Okay, great, thank you. I think if Dr. Alom can be brought back in the panel, there is a special question for the pediatric population, and if we can get her. In the meantime, there's a question that what is the percentage of asymptomatic COVID positive people, whether from China or all over the world? Do we know that how these people can make us vulnerable? Almost like a carrier.
There was some data that said that it's going to take multiples of 10 days for it to show up because we do have an incubation period. First, which they said was from 1 to 14 days, and then they narrowed it down to 5. So 5 is the current, but they're also saying that every 10 days, we'll probably see a spike. As long as we keep on flattening it out, the spike will get further pushed out. But I'm sure the other people have something to say also.
I think the question was that if somebody is asymptomatic, can they be asymptomatic and still carrier?
Absolutely.
Yes.
Absolutely.
Is there a percentage known about that?
Until we get the testing. That's why we want the testing done, so that we can get ahead of the curve, find how many cases there are, and then kind of try to see what our system can do for them and what to expect at the clinic.
Right, absolutely right. Because otherwise we don't know. And so far
Dr. Ramzan, can I comment, please?
Sure.
Yeah, just one question on packages. The study Dr. Fozia was referring to, actually cardboard does survive 24 hours. But there are if people have concerns, they should be concerned about receiving packages coming from China and stuff. I would say no at this time. As we said, the infectiousness of the virus doesn't survive too much on surfaces. Yes, on hard surfaces like metal, it does survive up to 72 hours. And the other point, do we have data on whether we have information about how many of the asymptomatic people are COVID positive? Unfortunately, sometimes we may never have this data, because if you're going to be asymptomatic, it's highly unlikely that you will be going for testing. So, it's highly unlikely that we will be getting this data.
Got it. No, excellent point. You're right that people who are no, so that's where there can be a population bias, and sometimes these percentages can be off, like the fatality rates and all that. Now, Dr. Alom is there. There's a question. Thank you, Dr. Peshima. Dr. Alom, a question for you is that people have disabled kids, how much they should be worried about them, and are these kids more vulnerable than healthy kids?
Assalamu alaikum, everyone. That's a very good question. So in the pediatric populations, we found in general that kids tend to get less sick with the COVID-19, at least from the limited data that's come out of China. However, that being said, we do have special populations that we worry a little bit more about. So specifically, we think about preschool children, children who are less than 12 months of age, and then our children who have underlying medical conditions, just like we worry about like in the geriatric populations. So that would include children who have disabilities, children who have let's say, a different way of expressing themselves. So let's say kids with autism, kids who have language delays, kids with cerebral palsy, kids with cystic fibrosis, children with very severe asthma, they can also get sicker. So it's really, really, really important in the pediatric population to think about these chronic underlying medical conditions and to make sure that if you're on a daily medication, so let's say if you have a child with asthma, make sure you're taking that Flovent. If you have a child with severe seasonal allergies, make sure you're taking that Claritin. If you have a child who is, let's say, has a hard time speaking or cannot communicate well, if you find that that child has a fever, has a cough that's worsening, reach out to your primary care office because now that we know that we have COVID-19 in the community and we know many children can be asymptomatic carriers, we have a much lower threshold to treat children over the phone. So communication with your primary care doctor is key and is very important in the pediatric populations. And yes, we should absolutely be careful with our children who have special needs.
Excellent. Thank you very much, Dr. Alom. There's a question here that I am in Suffolk County. How do I know where to get tested in my country? I'm in my county. So I know there's a website, but I want Dr. Qayyum, you want to give us that website that where people can go and find that?
Actually, I do know where it is, but can I just post it online for you? Because I don't know where I can find that.
Yeah, you can put it in the chat room so that
right, I put it there.
Can go there, perfect. Fine. And it's a HSA website, so that would be easier to find and go from there. The question is the virus now affecting younger age groups at a higher percentage? Hearing from the people that there are younger people in the ICU. So should we be worried about our younger kids who want to go out, volunteer, and do activities along that line? Even though this population was somewhat better, but should we be worried about that population now? Because this is another more commonly talked about news nowadays.
I think we should be worried. Again, there are kids or younger people who are also immunocompromised. You have the type 1 diabetics who are out there. They can easily do that. And then the other thing is, again, to the point that was made earlier, that you could be you could be just carrying it and not infected, and then you show up somewhere, and you could be the vector, so to speak, in communicating it to your elderly, or to bring it in a home, or to giving it to somebody in a nursing home. So the population that thought that they were impervious to any kind of disease, they're not. So we have to keep that in mind. And also,
even if you are young and healthy and your immune system is good, you don't have any comorbid conditions, you still observe the precautions.
Right, because you may have a friend who has those things and he's never told you. He may have MS, he might have lupus, he may have any number of things, but kids don't normally communicate it, and I don't think people in general like to tell what their illnesses are. And then you show up in that group of people and you can pass it on to them, and you're fine, but this kid is sick now.
Exactly.
And we all have to be really responsible in the community. Just because you're young and healthy doesn't mean that you're not responsible for the elderly populations. The other thing we have to remember too is that the demographics in the US are really different. So perhaps like the younger people were healthier in China, but their diets are different, their physical activity is different. So that really plays into how we respond to this virus as well.
But I think the main concern was that are there more younger people being hospitalized in ICU conditions because they turned out to be vulnerable? I'm assuming the question is about healthy young adults.
So recent data has shown that 40% of hospitalized people in the US are actually from 20 to 54-year-old.
That's pretty
high.
sad. Yes.
Yes. So yeah, unfortunately, fortunately, we're not seeing mortality, and they are strong enough to fight it. And as Dr. Qayyum mentioned, that they can give it to other people who can be much more sicker than them, but this is the hospitalized data, which means that they are sick enough to be in the hospital.
Thank you. The question is that if you have coronavirus infection, you are positive, and then you go to shopping and to touch fruit or any item in a grocery store, can it be transmitted to the next person who comes and picks that fruit?
Yes,
I would imagine yes.
Yeah, that is
yes.
a concern right now.
And then the thing of it is, we are not necessarily, some things we peel and wash and cut, some things we don't. We don't do that to, well, a few things we don't. And again, if say you've touched an orange and you've peeled it, it had something on it, and then you go and prepare food, or you're now eating the peeled orange. So you are getting whatever was on the orange onto your hand, and again into your mouth and your system. So yes, I think it is still a means of transmission. So properly washing your food, peeling it, again washing your hands, I guess, even though you started off by washing, I think it is important to abundance of caution, as they call it.
Absolutely.
You have to practice it.
Yes, absolutely. Now here the question from one individual is that people who don't have PCP, because nowadays we talk that you call your PCP if you have symptoms, and they will order the test for you, and then you go through a drive-through area and get the test done. But what if you don't have a PCP? What are the options? So I don't know, one of our physicians want to tackle that. Our Worcester city mayor has any input in that regard.
I'm sorry, I was distracted. Can you ask the question again?
The question was that if people don't have primary care physician doctor, because as city manager earlier said that you have to, and we all are actually advocating for our patients that if you have any symptoms, then please call your primary care doctor first. He will put the test in the system, and then you go through the drive-through.
Yeah.
Testing. But what if you don't have a primary care physician?
Yeah, I'm not sure the answer to that. I can find that out for you, but I know I caught a little bit of the governor's speech. You said they were expanding mass health if people didn't have that, or you probably could call the public health department and see if you could get tested that way. But I have to get back to you on that one.
Great. Thank you. Thanks. Let me read you the next question, that if you have recovered from COVID-19, you have developed some immunity, will it be helpful for you for the possible future COVID-19 infections? That's an idea.
So we don't know in COVID-19 what's going to happen. As of yet, the data from China has not come up for that. We know from the experience from SARS, which I had mentioned in my talk before, SARS is another kind of a coronavirus which caused an epidemic basically several years ago. So from that data, I can tell you that when they looked into patients who had SARS and then they recovered, how long they had those antibodies, which is antibodies are basically our body develops an immune system to fight future infections or fight that infection during that time. So the antibodies stayed for up to 3 months in those people.
The question along the same line, that if you had infection, are you quarantined for 14 days? Now, what are the chances that you may have infection again, because there were some cases reported along that line? So how much you should be worried about that?
I mean, if you start practicing bad hand hygiene again, or you're not taking precautions and the pandemic is still going on and you go outside forgetting, there are chances. As I said, there could be that you have developed some immunity. As of yet, I just cannot say that how much immunity, how long it's going to last. We think it may last for 3 months, but we are not sure. So you just cannot think that, oh, I had it and I cannot have it again. That's my message.
There was a case reported from Japan that this woman was infected and then she went back and tested positive.
Yes.
So there were two theories. That the way they theorized that was, it was possible that she didn't recover properly, number one. Number two was that the test wasn't as good and that she tested positive because our testing system wasn't that good in December, or that's when she got infected. So as Fawzia was just saying, we'll just have to wait it out and see. Like for some of the measles, mumps, rubella, and those other childhood diseases, we have immunity for a very long time. We do boost later on. So maybe we'll need, once the vaccine may even be, I think they're trying, there are 2 of them on trial, but I don't know if it'll be like a series of 2 vaccines just to get enough immunity to last you through the year. Because if this becomes a cyclical event and every year we have it like the influenza vaccine, then we'll have to get ahead of the curve again. And I think that's the reason why they're saying 16 to 18 months, because we're just not sure. We can't just hang our hat and say, we'll have to go through one more winter to understand exactly what happened in that cycle.
Excellent. I think I have to respect the time. It's 9 o'clock, and
Doctor, I get an answer for you on that. I'm not sure that if you don't have a primary care, I think the best way is contact one of our public health nurses.
Excellent.
And,
there's a hotline through the city, and I think
yeah, 799-1019. If and that's what people have been tested by. They can give you some guidance to that. Then the other question is, I'm going to confirm whether that's right. The 3 Biogen and the 3 school teachers are correct. That's not the information I have. So okay. I'll try to confirm that and with Dr. Hirsch tomorrow. But I had a lot different information. So, but I don't get. Sometimes you don't give me all the facts but I'm going to try to verify because I never heard that. So
perfect. No, that's fine. We will. I think I address that further in our next weekly. So again, to remind you that we will reconvene again next Friday, 7:30 here. Dr. Mike Hirsch will be also joining along with me at that day. And there were 2 comments here. Somebody commented that we are very thankful and proud for our Muslim women doctors, their efforts and their role in the society and helping the community in general and the society and our city and country in particular. So that's wonderful. Thank you very much again. And then somebody reminded that if you do not have the will, it's really time to think about that. Have your will in place, especially you have young kids, you are elderly, you never thought about it. It's time to think about it. It's always good to plan ahead and all that. These things are unpredictable, unexpected things. Nobody thought that we will be in a lockdown situation almost like this with a pandemic affecting the entire world. So yes, be prepared for that and be ready for that. Before I thank everybody else, I want to have a special thanks for our 2 youngsters here, Brother Kamal Shanak and Brother Nabil Sheikh. They actually helped us. They are the backbone behind this program with the IT, tech services and all that to make sure that we all are here conducting the program very smoothly without any glitches. So thank you, Brother Nabil. Thank you, Brother Kamal. Wonderful work. I thank all my panelists for their time and for their dedication. Thank you, Mayor, for staying with us all the way till the end of the program. I really appreciate that help, and also, your dedication and devotion for the community and city of Worcester. Thank you to my panelists, and inshallah, we will join again 7:30 next week with more to come, especially populations, pediatric population, immunocompromised population, and there are many psychiatry-related issues of anxiety, panic, and other problems. People may have PTSD. So these issues we will be addressing with our panel of two psychiatrists in the team also. So thank you very much. Thanks. If there are any other suggestions or any feedback, please do put in the chat room or write us directly to our address as president of wic@gmail.com or ask Imam Asif @gmail.com. Thank you very much. We are going to end the program. Good night to everyone.
Good night. Thank you.
Thanks a lot. Bye-bye.